Let's talk about cleaning the denture in the office. The first thing you're going to do is write your patient's name on a bag. We've had instances before where we've switched some, so very important that you always make sure the patient's name is on the bag. Then the next thing you're going to do is put the cleaner in the bag. Sometimes there's like a stain remover that's usually underneath the counter, or like a polydent tablet that you could use as well. So once the solution is in the bag, you're going to put the denture into the bag, zip that up, and then you need to double bag it. I always double bag it because I don't want any leaking of extra fluids into the area that are not supposed to be in there. They do make small ultrasonics that are just for dentures that you could get for your practice. This is nice because then it's not mixing with a whole bunch of different instruments, potentially poking the bag. There are some practices where you can put it in the ultrasonic cleaner that the instruments are in. Reminder that this water is very, very contaminated. So that's why I always double bag it. I usually always try to make sure too that there's no instruments in there at the same time, because instruments can puncture this bag and then the liquids can seep into the bag with the denture, and we do not want that happening. Usually you're going to let the ultrasonic do all the cleaning for you in about a 15-minute timed session. Once you're done with that, then reminder that outside of this bag is contaminated and we do not want to cross-contaminate it with the denture. So you're going to open both bags, and then the next thing you want to do is grab the denture really tightly, let all of the cleaner out of the bag, and then shimmy that denture to the top of the bag and carefully set it on a paper towel. You don't want to drop it from up high because you do not want to risk dropping a denture. You don't want to have to pay for a new one. Then you're going to change your gloves and you'll rinse off the denture really well before you give it back to the patient. Now, if the patient's not going to put it in their mouth right away, you can store it in an extra bag with a little extra water in it so that it doesn't dry out. And then when the patient's ready to put it back in, you can give it back to them.